1470, business and more. WWNN.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, my friend. This is Lou from All County Healthcare. We have a very, very special guest. And the name of the show tonight, realistically, it says, You and Your Doctor Live Longer and Healthier. Ladies, this is especially for you. Please, if you listen to this show and listen to the gentleman I'm ready to introduce you to, amazing physician, amazing young man, Dr. Frank Sarasano. Am I correct, saying that?
Right.
Dr. Frank Sarasano is practicing medicine. He practiced oncology and basically robotic surgery. Am I right?
That's correct.
Cancer oncology.
Cancer oncology.
Tell us exactly, Doc, what this means. It's primarily for females, correct?
Correct.
And what is your specialty?
Well, the specialty is called Gynecologic Oncology, and it handles a very small niche of patients, specifically those with issues related to cancer involving the uterus, the ovaries, the cervix, and the breast.
In that, now you can detect this at usually what age could this happen to a young lady or an old lady?
Any of these malignancy and cancer are synonyms. Any cancer or malignancy of the female parts can occur at any age, but usually the risk starts to rise after age 35, and then after age 50 it starts to rise even more.
Do you hear that? At the age of 35, young ladies, and at the age of 50, you should really be tested for this type of disease. Now, how could a female know that she could be basically subject to this? What are some of the symptoms that she would incur?
Well, some of the symptoms can be very vague. For instance, ovarian cancer is often called the whisper, in that the symptoms are very subtle. They include bloating, abdominal pressure or discomfort, slight changes in the bowel or the bladder function. And a lot of times these can be assigned to GI complaints, irritable bowel syndrome, and not even be worked up for GYN cancer.
And so if a person thought they might have some normal, whether they're bleeding continuously, etc., now they would come to see you?
Yes, so that's the other that Lou just mentioned. Another important sign, besides abdominal pain or pressure, pelvic pain or pressure, is bleeding. Any irregular bleeding, whether the bleeding is irregular during the menstrual flow or any bleeding after the age of 50, needs to be evaluated for possible malignancy. And then that evaluation often includes imaging. And the most common imaging study is an ultrasound.
Okay, let's say you detect or you suspect something might be wrong with this young lady or older lady that comes in to see you. What are some of the things that you do to perform to find out if it is cancer or not cancerous?
Well, I think the basic history is very, very important. Beginning with family history, a lot of information can come from the family. If there's a very strong family history for breast, ovarian, uterine cancer, then the patient may qualify for genetic testing. And that can be done in the office.
And where can you get that done?
We do that in our office, and it's available at many other offices.
Okay, genetic testing, and also if you feel that you want to just get a regular gynecology checkup,
Correct.
you will even see the
And we
patient
do
with
that as well.
And that number where you can reach him, ladies, is 561-447-0090. That's 561-447-0090. And he can make an appointment. You can see Dr. Cirisano. Whoever's on the phone, they'll make an appointment with you. You come in to see him. You can get these unbelievable testing now, which weren't available for you years ago, right?
That's correct.
Now, you also today, if you did surgery, you would do what they call robotic.
That's correct, too. The landscape for surgical intervention has changed drastically. Years ago, it involved a very big incision and a significant recovery that was measured in months. Now we're able to perform the same surgery through the belly button, if you can believe it, through an incision as small as a dime. And we do that using a small instrument that's controlled by a robotic arm. And the surgeon, myself, actually controls the computer in order to remove specimens, organs, and tumors.
So the healing time is much shorter.
Healing time is generally in the matter of days, and the procedure can be done as an outpatient.
As an outpatient.
They can go home the same day or perhaps the next day.
And let's say you detect this, you think during the surgery you could detect certain cancerous things. What advice would you give to a patient, a female? What's her next step if she needs oncology?
Well, I think to just reiterate, early detection is the key. If we're able to detect cancers of the ovary, the uterus, the cervix at an early stage, usually termed stage 1, then those patients have a very good survival on the order of 95 to 100%. So early detection and awareness is probably the number one factor that can play a role in survival.
You know, a lot of our listeners, Doc, this is what amazes me. They always tell me, you know, I don't trust these doctors here in Florida. I want to go back to New York, or I want to go back to Boston. I want to go back to Chicago. And I can tell you that I think we have some of the finest doctors. Take you, for instance. You have a tremendous amount of degrees from all these universities. Tell us about some of these universities you've been to.
Thank you, Lou. The training for GYN cancer or the specialty of GYN cancer takes 12 years. And I started that training in New York City, actually, at Columbia University. That was followed by a residency in OBGYN at UCLA, the West Coast. And then I came back to Memorial Sloan Kettering, where I studied my fellowship in GYN cancer, and eventually went to Duke University, where I finished my fellowship.
So imagine you're telling me you're going to go back to Boston or New York to get tested, to get examined by a guy that's 80 years old or 70 years old, and who's really not up to date with any of these new procedures. And I'm sure there's a number of new procedures, right?
Well,
and you're practicing at Bilger Community, which is part of, I understand, Bethesda, that whole group, Baptist group. And you've been on staff there for how long?
23 years.
23 years.
It's quite a long time.
That's a long time.
Yeah.
23 years on staff at Boca Community.
Yeah, good years.
And how many years at Del Rey?
Same, 23
23
years.
at Del Rey. So, okay. So look, this man's been in business 23 years. He's been doing this thing, and he's up to date. He's got the finest of degrees. I recommend, if you're 50 years of age, I don't only recommend, I think he recommends it. If you're 50 years of age, then you want to give him a call. It doesn't cost you anything because you accept insurance, correct?
We take all forms of insurance.
All forms of insurance. You take Medicare?
I would take Medicare, biggest provider.
Yeah, he takes Medicare, one of his largest providers. And if you feel as though that you're really concerned about this because you know someone who's had cervical cancer, or you think that someone passed away of cervical. I know someone that has cervical cancer now, and I know someone that passed away of cervical cancer. So if you're really concerned at all, at least go and get a genetic test.
That's an option.
And you can give a genetic test.
Correct.
At your office. So again, he can give genetic testing, which is very simple. I don't imagine it's not invasive.
Genetic testing, actually has gotten easier. It had been a blood test where we had to actually draw blood. Now it's a saliva test. A patient literally just has to spit in a cup, which takes all of about 10 minutes.
And that's all since the new DNA has come out.
That's how the new DNA test is done.
Right, it's amazing. So tell us about robotically, oncology and robotic, what you do after you find out that this person does have the problem.
Well, using the robotic technology, we're able to not only diagnose and remove tumors, but we can also do something called staging. Staging is a procedure where we do biopsies around the tumor to check for spread. And again, that can all be done using this very small incision and a robotic arm, and the patient can go home the same day.
Now, I was discussing with you, you said earlier that if you do this robotic surgery, the person comes in and thinks they have cervical problems. You can even find out if they have other types of cancer, breast cancer, etc.
Correct. The genetic testing actually is the window to their risk for breast cancer, ovarian cancer, uterine cancer, and to some extent cervical cancer. But cervical cancer is felt to be driven by a different etiology, something we think is related to HPV, a virus that can be transmitted.
And this even can happen to high school people, right?
It can happen in high school. Any form of contact can transmit the virus. It does not require an intimate contact.
So that means any type of contact that's like a virus that a young lady or a person is there only young women? It could happen to men or women?
Both, men and women.
Can it have HPV?
Yes.
And if men have it, that means transferred to a female.
And vice versa.
Through intercourse?
Through intercourse or any type of physical contact.
It's amazing. So what you're saying now is you're saying that if you think and you're 18, 19, or 20, now what are some of the symptoms of HPV?
Well, HPV doesn't have specific symptoms per se, but infections, any type of female infection, can be a manifestation of HPV.
Would they come and see you for that?
They would come and see any GYN specialist like myself.
Okay, so if you have an OB/GYN gynecologist, what you should do, you recommend how many times a year should he test it? See him?
A Pap smear is generally done after the age of 18 to 21 on a yearly basis, and it's done through age 65. After age 65, if the patient has regular Pap testing that's been negative, they generally consider those patients to fall into a lower risk bracket. And Pap smears don't have to be done after age 65 in a low risk patient.
Now, your specialty is surgery, but do you do general gynecology too?
We handle pre-screening, cancer screening, and evaluation of any problem in the GYN area.
So, ladies, if you're out there listening, please pay attention. Call this number, 561-447-0090, if you think you surmise that anything might be wrong with you, gynecologically. Am I saying that correctly?
Cancer or precancer.
Precancer. Doc, tell us something about years ago when we didn't have all this testing and all these new methods. What was the survival rate, let's say, when you started?
Well, unfortunately, I started 1990 and then finished my OB/GYN in 94. At that time, the survival rate for ovarian cancer was about 6 months to a year.
6 months to a year. Ooh.
And that was largely because most of those patients were not caught at an early stage. They were the type of patient we described earlier that had bloating, discomfort, distension of the abdomen, and they were largely ignored until it got to the point where they ended up in the emergency room. And that's often the location where we were first introduced to the patient.
And today?
Today, most patients are able to have the surgery like we described. Most patients are able to go through additional therapy, which can sometimes require chemotherapy or radiation therapy. And to the extent that we're able to treat them, most patients are able to go on with their lives.
Now, would you do the oncology to be sure?
We do the oncology, correct. So we direct the chemotherapy and also coordinate radiation therapy in those patients that actually have tumors that are spread beyond the organ of origin.
Doc, at this time we're going to take a little break, 30-second break. So we'll come right back to you.
Great, thank you.
How do you like it so far?
Good.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back. We have Dr. Frank Sarasano, Frank Sarasano with us tonight. His phone number again is 561-447-0090. You know, Doc, we talked about cervical cancer. We talked about all that. What is ways of detecting this cervical cancer? What are some of the ways of detecting it?
One of the most important innovations was in 1950 when the Pap Smear was developed, which is a sample of cells taken from the opening of the womb. And that can be analyzed now by a computer. Those cells can be analyzed and evaluated for precancer so that we can identify patients before they even develop cancer.
So that means if you're doing a Pap Smear
Correct.
on a young lady and you put this under the microscope or wherever you do it, to the computer, you can detect if she's precancerous or could be cancerous down the road.
Or even at risk for cancer in the future.
What is this thing? Do you do any kind of imaging?
Well, there's a whole set of different imaging options. One is an ultrasound of the pelvis. Most people are familiar with an ultrasound which can image a fetus, a baby in utero. But the ultrasound can also be used to identify uterine tumors or tumors of the ovary and also tumors of the cervix.
Okay, what's the other type?
In addition to that, we have an MRI. An MRI is when the patient passes through a tube and we take pictures. And that study is actually even better than an ultrasound, quite more expensive.
You know, people say MRI. What does MRI stand for?
Magnetic resonance imaging.
It's the first time I ever heard that. Magnetic resonance imaging? Everybody said, "We're going to take an MRI." What is it?
Which means it's a magnet. It's a image that's made by magnetism, and there's no radiation.
And it makes all that noise while you're in that tube.
It makes all that buzzing.
Now they have an open one, right?
They have an open one, and they are able to reduce the amount of time it takes.
Okay. And what's the third one?
Third one is a CAT scan. Computerized tomography. That's what the initials stand for.
Well, that's another thing. When everybody says they got over CAT scan, I think they start getting fear. They start getting scared.
Of course.
Fear sets in. Yeah. Everybody thinks you're going to have cancer, right, when they go through a CAT scan. What are some of the, when you detect, what are some of the treatments of this?
Well, years ago, the only treatment we had was surgery. And then with the evolution of chemotherapy, we now have options that are able to treat patients with cancer that is actually spread beyond the organ of origin. That evolution initially caused a lot of side effects like nausea or vomiting, hair loss, and the newer chemotherapies are actually much more advanced and are able to kill the cancer without causing a lot of these side effects.
Now, is radiation also used?
Radiation is also used. Radiation is different from chemotherapy. Chemotherapy is a drug that's introduced usually in the IV, and it circulates throughout your body to kill any cancer cells that could be anywhere in your body. Radiation, on the other hand, is focused on one specific area, and it's usually focused on the area that we remove the tumor. So if we remove the tumor, we can radiate that local area to kill any cancer cells that could be left behind, and the patient can also get chemotherapy to kill any cancer cells anywhere in their body.
Well, I had a secretary, she passed away on me for 17 years. She found a lump on the leg,
Okay.
right? And everybody said hematoma, but it was a rare cancerous thing that only happens to kids. It was orthopedic type cancer.
Yeah.
They did radiation, and then on the first treatment of, I don't want to scare anybody, first treatment of chemo, it really affected her badly, and she never came out of it. So chemo can be...
Chemo can be, to some degree, destructive to the body and to the immune system. There are different remedies to try and prevent that destruction. You may see them advertised on TV, shots, stem cell shots called erythropoietin to help build your immune system and build your blood count. But I would also mention that the field of medical oncology has evolved even further to include immunotherapy.
Everybody's talking about this now. What is that?
Immunotherapy is a little bit different from chemotherapy. It's an infusion that goes in the IV, goes throughout your body, usually takes a lot less time, on the order of 30 minutes, and it helps boost your immune system and helps you to fight the cancer yourself. And
Now,
that's
is this-
really quite a remarkable innovation.
Is this being done in our area?
This is done routinely in both hospitals, Delray and Boca Regional Hospital, and it's now pretty much routine part of the practice of oncology.
Can you do
specifically
that?
GYN oncology. We do that.
You do that also?
Yes.
So you make a decision with the patient what you think the best treatment is for her, you proceed. So she can accept or reject whatever treatment you...
Of course.
What you prefer. Okay. Now, one thing that interests me, this HPV,
The virus.
the viruses.
Human papillomavirus. That's what HPV
This
stands
is,
for.
I see this about a few years ago. The concern was giving their daughters or their sons the shots. A lot of them refused this. Didn't want to get the shots. Now, are those shots still available today for that treatment?
The shots are not only available, but they're endorsed by the FDA, and the recommendation is that all children after the age of 13 be considered for the HPV vaccination.
Oh, it's like a vaccination.
That's correct.
So they're saying anybody after 13 should get this, either male and female?
Male and female, both sexes are candidates for HPV vaccination after the age of 13, and that's to help prevent transmission both ways, as we discussed earlier.
Mothers, if you're listening to this, now I never realized he's saying after the age of 13, they're recommending that all children get this HPV vaccine.
Candidates.
Candidate for what makes them a candidate?
Just the age.
The age.
Yep.
So
And the vaccination is effective at preventing HPV carrier state, preventing them from becoming a carrier of HPV over 70% of the time. So it reduces their risk of having any HPV-related pathologies, cancer, in the future by 70%. And that doesn't include just cervical cancer. It includes oropharyngeal cancers, tongue cancers, esophageal cancers. There are HPV-induced
esophageal cancer
malignancies.
too?
There are HPV-induced malignancies that are outside the scope of cervical cancer
Now,
that can occur.
esophageal cancer that's almost like a death sentence.
I think there are new remedies now. I don't want
Today?
to. I don't want to stray too far from the GYN
Okay.
focus, but there are certainly remedies.
So that's amazing. So this HPV shot can do a lot of good for these
Can do a
people.
lot of good.
Now, a person develops something like that. Is the shot then can it be applied?
After the patient becomes a carrier
Yeah.
of the virus, they're no longer considered a candidate to get the HPV vaccine because it's thought that they already are a carrier. And the vaccine is not going to reverse their carrier state.
I'm going to ask you another crazy question. How would this affect cervical cancer? Let's say a woman doesn't know she has cervical cancer, but she's pregnant, and it's detected during the pregnancy. I don't know if that's a crazy question or
no,
not.
not a crazy question. It happens. Cervical cancer or precancer can be detected during pregnancy, and it generally is on an individualized basis, carefully evaluated. But in states of precancer, we generally observe the pregnancy until the delivery, and then consider management. In the patient with cancer, it has to be individualized to determine what to do based on how advanced the cancer is. Very difficult issues.
Where do you see this field going today? You being a physician, with all the new technology coming out, I'm sure that you're enthusiastic about what's coming out.
Well, I think two things. Surgery is going to continue to evolve, and the role for robotic surgery, I think, is already been defined and will only continue to grow. Second, the role for genetic testing and growing our understanding of how patients can have these tests to prevent malignancies, I think that will only become part of common care.
Now, is cervical cancer have any relation to diet or exercise or?
Well, cervical cancer is hard to pin down as having an increased risk, with different diets or exercise patterns. And obviously, it's always important to exercise regularly and have a healthy diet. But we don't have any clear, compelling evidence that dietary changes or exercise will affect cervical cancer.
Because I see a lot of people that have cancer with cervical, they decide to become naturalists now. They go out and nature's going to heal them.
Well, I think it's always healthy to make those changes in life.
Right.
I don't know that that's going to reverse the cervical cancer if it occurs.
Okay. Now, when you're talking about oncology and cervical cancer, do you see an increase in that as the people are growing older? Unfortunately,
we do see it more, and we think that's partly related to the fact that our populations, the elderly, the proportion of patients living on well beyond 70, 75 years of age is increasing.
Again, you were talking, could this be transferred from mother to daughter, genetically?
HPV can be transmitted.
Not HPV, cervical cancer.
Okay, cervical cancer risk is not considered highly hereditary. It's thought to be an external HPV-related issue.
1 minute.
Hereditary cancers are more considered breast, ovary, and uterine.
We have 1 minute left. So, Doc, tell me what you like to end this.
Well,
I like to. You know what I like to end? There's two proverbs that I've seen. If I get just run a little longer for any time, I see these two proverbs, right? And I think they're amazing proverbs. What? Hold off. One of the proverbs was, which I think was great, he who has health has hope, and he who has hope has everything.
I like that.
The other proverb is, it is health that is real wealth. It is health that is real wealth. Good night, folks. Thank you so much. Doc, come back anytime.
Thank you, Lou. Appreciate it.
All right.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met. And I never worry. I hope you never need a nurse to come to your home. But if you do, tell your doctor, I want all-county health care.
This is the FM Money Talk Radio Network, 95.3, 96.9, AM 1470.